everyone to a very special series, Heart Talk, as we take our steps to create awareness this week dedicated to CHT or congenital heart defect warriors and their families. I'm Priyal Guliani. I'm also a mother of a child who had CHT, but unfortunately, our story was not that successful. So today, as a Genesis Foundation is championing Har Dil Dhadakna Chahe, a very beautiful message during the CHD Awareness Week, I'm joined by a very special guest, Dr. Swati Garekar, who is a senior pediatric cardiologist in the Fortis Pediatric Heart Care team in Mulund. She has been part of the center since 2006, ever since its inception, essentially, and is one of the first comprehensive pediatric cardiac care centers in Mumbai. Thank you, Dr. Swati, so much for joining us today for this very important conversation. In our first part of series, we did in-depth discussion on screening aspect of it. And now I want to bring the important question is that when the screening reveals an anomaly in a child's heart, what are the next steps that a parent and the team of doctors need to take together as far as the understanding this anomaly that comes into screening?
Thank you, Ms. Priyal. It's actually my honor to be here. I'm so glad to be part of this project. With regard to your question, what should the parent, the couple do next when they are handed a report which says the fetus has a heart defect? Well, surely the radiologist or the obstetrician would have told them to consult a pediatric cardiologist, because that person would be the best to be able to guide them further. So when such a couple comes to me, what I like to start off with is, okay, what have you been told so far? Sometimes they've been scared a lot. Sometimes they've been told nothing. So that's one question which tells me, the answer tells me where they are at. And then we go about explaining the whole thing. One thing I like to highlight in the very beginning to relax them is that, listen, whatever happened that we are discovering now at 20 weeks, actually the foundation was laid well before. By the time you discovered you were pregnant, around 6 to 8 weeks, that's when the heart is almost all formed. So whatever, and I look at the mom and dad both, that whatever you guys did or didn't do after that, it doesn't matter. So I without them even asking, tell them that, listen, this has been well researched and we really cannot blame somebody for this. Okay, so then I go about explaining what the heart defect is. I start with how normally it should be and how it is over here. I then like to take them through best case and worst case scenarios. So the best possible outcome, for example, if it's a hole that was discovered in the fetus, a hole in the heart, best possible scenario, maybe it may close on its own. But we will also look at the worst possible scenario. Well, the hole may have some associated defect which we have not seen yet on the fetal echo. So that needs to be accounted for as well. It may come as a surprise after birth when we do the complete echocardiogram on the baby, or the baby is likely to need an open heart surgery.
Pregnancy, Dr. Swati, as it is, has a lot of challenges and sometimes is a cakewalk as well. And you're always planning for what you can do to make your delivery more comfortable, and you're planning towards it. How does this diagnosis change the way you need to work towards your delivery? How does that change?
Real important question. So I do like to prepare the parents. So one thing is mental preparation. So let's say the heart defect is somewhat major, meaning definitely an open heart surgery will be required in the first few months of life. So we talk about how right now really the couple can do nothing, need not do anything, because the way the blood flows inside the fetus means that however it is happening is not really harming the health of the baby grossly. So baby will not act different, the mother will not feel anything different. Mother need not look out for anything. And basically, the focus should be on a healthy pregnancy. A good weight would be a bonus for the pediatric cardiac team, waiting to do surgery on the baby. Another aspect is the financial burden that care of such a newborn may impose on the family. Usually the families, a young couple, first job, little savings, and insurance won't cover it. So, obviously it is likely to be a financial burden. So we talk about the costs involved and how they can start preparation for it. In India, especially, there are a lot of government schemes that our social workers help them get in touch with. And of course, NGOs like, Genesis that help out very much.
Dr. Swati, you mentioned right now with regard to the fact that you give advice to the mother to take care of her own self, but obviously it is a very, very difficult situation to deal with. You don't expect such things to happen when you're already looking for an addition to your family, and so on and so forth. So as far as the mental health support system is concerned, do you think we have the ecosystem currently?
Absolutely, you're absolutely right. And like I pointed out before, the mental health is paramount because that will determine how well the baby grows. Kind of comfortable gauging at how the couple is going to handle it. I do spend a lot of time talking with the husband and accompanying, either it is the mother or the mother-in-law. And I after stressing that it's not the mother's fault, I absolutely focus on how we need to look at the positives and leave aside the heart and just focus on how they were handling the pregnancy prior to the diagnosis. So up to 20 weeks, how they manage, that's how they have to manage the next 20 weeks.
My experience was that I was in a nursing home where they did not even have the fetal echogram machine to look into. It's just that coincidentally the oxygen rate did not go up, levels did not go up, and that led to a doubt in the mind, and the murmur in the heart was detected. And then on day zero of my child's birth, we had to move her to, with an ambulance, to a multi-speciality hospital. That brings me to the question of that, given that you have had a screening, you've had an analysis of something that is there, does that also change in terms of what you need to take the next course of action to, moving from say a nursing home to a multi-speciality hospital, or how does the different range of CHT that we know or are aware of changes the next course of action?
Thanks for highlighting this, Priyal. So definitely changes, and it forms an essential part of the counseling a pediatric cardiologist would do. Something like a hole in the heart, we would say, okay, so go ahead with your pregnancy, the way it's been with your obstetrician, go by how they say with regard to when you're going to be delivered, how you're going to be delivered, and where you're going to be delivered. But probably, once the baby's born, before you go home, make sure a pediatrician examines the baby, and of course get an echocardiogram before you go home. So you may actually be scheduling an echocardiogram in the nearest pediatric cardiac clinic, and that should suffice. So that's one end of the spectrum, really dealing with a relatively simple kind of heart defect. On the other hand, once we get into the complex kinds, where neonatal care is essential, this is where we say, listen, let's talk about the ideal situation. Ideal situation is that actually the delivery is taking place at the time when the obstetrician wants. We would like a full-term baby. And the mode also in 95% of cases, it's as per the obstetrician. We do not need cesarean sections, even if it is a truncus or a TGA or any other major heart defect. So it is as per the obstetrician what they feel is appropriate for the mother. Then as far as the place of delivery, so ideally speaking, the place should be at a place where there is obstetric setup and a pediatric cardiac setup at a level where even surgery can be performed. So that is ideal. So for various logistic reasons, it's not always that this ideal situation is achievable. So we have gotten into situations where the delivery happens in a nearby nursing home, and we're prepared for it, and our team goes and gets the baby safely. Most of the time with most heart defects, even if it's a truncus, for example, a little baby with a truncus, we are able to we have enough time for the baby to be taken up from where the baby is delivered up to an ICU. And sometimes they are coming from the village or some other small town, so we even discuss where the delivery should be.
Another very important question, and again something that has stemmed from my personal experience of a myth or a truth, that what is the probability that if you've had a child with a CHT, that probably your next child will also have the same? Is the message that I got initially, which was of course not accepted by a lot of doctors otherwise. So a truth or a myth is what I would like to know from you.
So yeah, so there's a lot of anxiety about this question. My child has a heart defect. What about my next pregnancy? What are my chances? So luckily, we have good news to share most of the time, and we're able to say there's a very high chance your baby's going to be normal. Very high chance. And but we say, but there is a higher chance than the general population that there might be a heart problem. And we'll begin by scanning carefully at 11 to 13 weeks of gestation. We look for a couple markers of heart defect. We can do an early fetal echo at 14 to 16 weeks of gestation, and certainly by around 18 to 19 weeks gestation we'll do a full-fledged fetal echo. Now they may have also gotten genetic screening done, so that also helps. Either the prior fetus or the parents themselves may have gotten screened based on what kind of heart defect the previous baby had. So that's how it is.
Okay, all right, Dr. Swati, thank you so much for joining us, as you play a very, very critical role in this ecosystem with regard to the supporting the kids with heart defect. It's a very, very important journey to take I think doctors play a very important role in hand-holding parents who have to go through these circumstances. And as Dr. Swati pointed out to all those who have joined us, that it's not just about dealing with an issue, it's also about dealing with a financial cost. And as Genesis Foundation has been working towards it, I urge you to go through their website at genesis-foundation.net, and let's try and work towards Har Dil Dhadakna Chahe. Thank you so much for joining us.